Hello and welcome to Health Matters on Channels Television. I am Mary Alale Yusuf. Infection prevention and control, or IPC for short, is a practical evidence-based approach preventing patients and health workers from being harmed by avoidable infections. Principles of infection prevention and control are relevant to every health worker and patient at every healthcare interaction all over the world. Ignoring these principles could cause harm and can kill. For example, we all know that one's hands should be washed after using the bathroom to avoid transfer of germs. According to the World Health Organization, the occurrence of adverse events due to unsafe care is likely one of the 10 leading causes of death and disability in the world. Without effective IPC, it is impossible to achieve quality health care delivery. My guest is National Infection Prevention and Control Program Coordinator, Nigeria Center for Disease Control and Prevention, Dr. Tochi Okwo. She joins us from our studio in Abuja. You're welcome to the show, Dr. Okwo. Nice to see you.
Thank you, Mary, and thanks for inviting me.
Let me first start by asking you, what are the minimum requirements for infection prevention and control? I know, as simple as it sounds, it can be quite a deep question. Minimum requirement.
The minimum requirements for infection prevention and control are those set of standards, those things that must be in place everywhere healthcare is provided that will guarantee the minimum safety for health workers and patients. In other words, those things that have to be put in place in hospitals, everywhere healthcare is provided, so that as patients and healthcare workers interact in the healthcare environment, the avoidable harms from such interactions, those infections that could result from such interactions, can be prevented. So these are those minimum requirements of infection prevention and control. And that is actually the main goal of our National Infection Prevention and Control Program in Nigeria, the Turn Nigeria Orange Program.
So on the minimum, we are talking about gloves, running water, clean towels, stuff like that.
Oh, well, they could be part of it, but there's a logical sequence. There's, like you said in your introduction, this is an evidence-based thing. In other words, it has to be done right, the right way. The process, the structures need to be in place. And therefore, when we talk about the minimum requirements that must be in place, you have to have what we call an infection prevention and control program in the health facility, meaning that you have human beings whose job, whose responsibility is to support other healthcare workers as they interact with the patients, to put in all those IPC principles and practices in place to make sure that healthcare is safe. That is one of them. And these people need to be trained. They need to be competent professionals. And you can have the program, have the competent professionals. Another minimum requirement is that they have to work within good evidence using guidelines. So these are also the things that need to be in place. And then you talk about the environment. That's where your water, sanitation and hygiene infrastructure, the ability for them to do proper hand hygiene, all those minimum requirements would need to be in place. Recall also that why we need infection prevention and control is because we want to avoid infections from moving from one patient to the other, or from a health worker to a patient. Therefore, the minimum requirements also requires that there be a system for monitoring the proper practices of infection prevention and control on one side, and also that there's a system for keeping watch, what we call surveillance, for keeping watch and tracking these healthcare-associated infections, which are the main reason why we want to do IPC, to prevent them. So the surveillance part of it and the feedback to these health workers that we're empowering to do the right thing is also important. And when we look at our bed occupancy, the staffing, bed occupancy, there are minimum requirements. Overcrowding in hospitals. We need to put in systems in place to make sure there's no overcrowding. So you can see that it's not just only having personal protective equipment, PPE, as you said it, but making sure that the systems are in place, the processes are in place, health workers are then capacitated with the knowledge and the skills to implement all these things.
What would you say are the major challenges in Nigeria of keeping people infection-free?
Well, I'll first of all say that preventing infection, challenges in preventing infection is not unique to Nigeria. In every part of the world, transmission of infection in hospitals continue to be a challenge. And the reason is that the healthcare environment is a unique place. It is that place where people who are sick, who are vulnerable, come, and health workers would then need to deploy their skills on these vulnerable patients. And therefore, you can see that it's an environment where infection can easily be transmitted. And this challenge is not peculiar to Nigeria. However, there are challenges with infrastructure, the built environment where healthcare is provided. Often, people do not pay attention in the building of the space where healthcare is provided. Therefore, you see hospitals that attention has not been paid to water, sanitation, and hygiene, hospitals where attention has not been paid to ventilation, hospitals where attention has not been paid to separating those that have the ability to transmit infection, therefore isolating them. So some of those infrastructural challenges are the ones we also encounter. There are also the behavioral challenges, where health workers often, for many reasons, are unable to implement the changes that they need to implement. Often they have the knowledge. Even when the infrastructure is provided, health workers sometimes struggle with carrying out these IPC practices. So these are some of the challenges, but we continue to work with health workers all over Nigeria. We continue to mentor, we continue to coach, and we continue to encourage so that these challenges can be overcome.
Do you ever, in some communities, have a problem with people understanding what the fuss is about? For example, having a water closet system and, washing hands, having sewage system. Do you have those problems? We do know that in all over the world, and Nigeria is not really all over the world, particularly in the less resourced parts of the world, there's always that constant struggle to provide adequate water, sanitation, and hygiene infrastructure. And yes, we also encounter such challenges in Nigeria. But when you talk specifically for health facilities, well, that is a challenge. It is something that all of us must work hard to overcome. And I will bring you back to the minimum requirements and the minimum standards. In acknowledging that this is a challenge, it is also an opportunity to overcome these challenges. Every health facility must be able to have some sort of running water within the premises of that health facility. You could have primary health facilities that provide a certain range of services. The requirements for their own water in terms of the quantities and where it will be in the premises will be different from perhaps a general hospital, and definitely such requirements will also be different for tertiary hospitals and other places where more complex care is provided. And I'll come in here again and say that this is also what we continue to do in our national IPC program, to work with hospitals, to understand what their own minimum requirements are, work with them to discuss the challenges, and support and collaborate to try to strengthen IPC practices
and overcome some of those challenges.
We know that it's the responsibility of the hospital and healthcare workers, to safeguard the health of their patients. But it will help a lot if a patient is educated in such matters, is enlightened in such matters. How would you advise a patient to guard his own health, guard against getting healthcare-associated infections or HAIs?
Okay, thank you, Mary. Well, they say, I'll use this term, charity begins at home. And to say that every infection prevented is one less infection to bring to the hospital. So the starting point is that all of us must imbibe hygienic practices. Things as simple as keeping our environment clean, things as simple as teaching our children how to wash their hands anytime the hands are dirty, washing our hands before eating food, protecting our food sources so that these harmful organisms that cause infection will not get into them, and keeping healthy generally would mean that a patient will not have to come to hospital in the first instance, and therefore does not even run that risk of having infection transmitted in the hospital. And then the second one is that inevitably, one time or the other, we will find ourselves in hospital. And it is usually, we think that why IPC is important is because of the outbreaks, the Lassa fevers, the COVID. Yes, while these public health emergencies are important, every day in hospitals, we have vulnerable patients coming. And Mary, as I speak to you now, a premature baby is born somewhere in Nigeria. And that premature baby will be in the hands of a healthcare worker as we speak now, who will struggle to provide that baby a fighting chance in life. And it is because of such babies and such vulnerable people, we do have cancer patients as we speak now who are in hospitals in Nigeria who run a higher risk of infection. And therefore, patient education, collaborating with patients to understand why the activities and some of the things a healthcare worker may need to do. So that when a healthcare worker puts on the gloves, a patient needs to understand that it is not because the healthcare worker feels that the patient is dirty. It is just the healthcare worker putting in those IPC practices that will not only protect the patient himself, but others. And then, when patients come to hospital, they are in partnership of trust with the healthcare workers. Patients will also be encouraged to support health workers to make IPC practices an easier choice. So when a healthcare worker tells a patient to maybe wash their hands or maybe to keep their environment of care a bit cleaner, and then the patients would necessarily need to understand these things. Another group of people are the caregivers themselves. So it's a complete partnership between the health worker and the patients. And patients are also encouraged to really speak with their healthcare workers. Talk to your healthcare worker on hand hygiene practices in the hospital. Ask your hospital how you can support as a patient group to make IPC practices easier options in that facility. So it's really not only for the health workers. Communities can walk into hospitals in the environment and ask how they can collaborate. How do we make this hospital safer? How do we ensure that as we walk through this hospital in our clinical care pathway, that we support health workers to make the job easier, knowing that at the end of the day, everybody benefits?
Stay with us, Dr. Tochi, as we go on a break. When we come back, we'll continue from there. We're going on a short break. We'll see you on the other side. Welcome back. We're talking about infection prevention and control on Health Matters on Channels Television. you can call 0808 054 2233 for questions on the topic. You can also tweet at CTV_Mary A or send email to moalale@channelstv.com. Dr. Oko is with us today, and I want to ask you, Doctor, we know that one of the things that infection prevention control measures will prevent, is people over-treating themselves. So the cases won't arise, so people won't over-treat themselves for a problem they have and thereby cause antimicrobial resistance. So here we are with one or two things, or perhaps more, where antimicrobial resistance has developed and is becoming a race against time. What would you say are the conditions that we have the most problems with due to antimicrobial resistance? I know TB is one of them, that I know.
Mary, I think you may need to rephrase your question so that I can give a most appropriate answer.
I'm asking, what conditions do we have the most problem of antimicrobial resistance with in Nigeria now?
You have mentioned TB, and that is appropriate. We do have a problem with multi-drug resistant tuberculosis. But what I would like to say in answer to your question is that for every infection now that is transmitted in hospital, there is a risk that it could be a multi-drug resistant infection. The antimicrobial resistance is not necessarily a disease condition, and I would like to make that clear. Antimicrobial resistance is a situation where antibiotics that used to be effective in treating a certain infection is no longer, or lose their ability to be that effective in treating that particular disease. So you can see that the same organism can cause different kinds of infection in different parts of the body. Why infection prevention and control remains the bedrock is that if somebody gets an infection that is caused by a drug-resistant organism, that is, if what is causing a patient's infection is an organism that is now resistant to many of the antibiotic options that usually will be available for that. Such a patient, if he transmits that infection to another patient, is transmitting to that patient a drug-resistant infection. And that means that the option continues to reduce for the antibiotics we have to treat infection. And that, for me, is what is most appropriate answer to this question and brings us back to the need for continuing to do everything possible to make sure that the environment of care is safe, that health workers know what they need to do to prevent the transmission of infection from one patient to the other, because often in hospitals, these infections are also infections caused by drug-resistant organisms.
You know, when COVID-19 came on the scene, there was so much panic, people were so scared, and for some of us, it's like we were blindsided by the disease. People wonder, after so much breakthrough with prevention of diseases, the coming of antibiotics, penicillin, and all that stuff, why do we still have diseases emerging on the scene? Can you enlighten us as to that?
Mary, we live in an environment where we are surrounded by microorganisms. Many of them are good for us. Our body is full of microorganisms that we live in this beautiful symbiotic relationship with. We also cannot even exist if we do not have microorganisms. But then you have the harmful ones that are the pathogenic ones. In other words, those ones that make us sick. And all over our environment are also microorganisms. Those things our eyes cannot see. They are the bacteria, the viruses, and all sorts of things. And they exist often also in their niches. And therefore, the threat of emerging and re-emerging infectious diseases will continue because the factors that drive these things are here. Human beings continue to move into the spaces and niches of these microorganisms. International travel is at the speed of, I can be in Nigeria today and within 24 hours, I'm in some exotic jungle in another parts of the world. The climate is changing. So these ecological things that are going on continue to make it easier for infections to move from one place to the other. And therefore, it is no surprise that emerging and re-emerging infectious diseases continue to happen. But this is where we as human beings will continue to make sure that we put in things in place to prevent the emergence of these infectious diseases as much as we can, but also put things in place to pick them up early if any new one occurs. And then to continue to make sure that our hospitals are strengthened, that the capacity of our hospitals is strengthened so that they do not amplify these infectious diseases when they happen. And that even when such infectious diseases come to the hospital can manage it effectively and then stop the transmission from one person to the other. In other words, break the chain of infection, as we call it.
I think we are getting a call. Hello? Okay, we lost that call. Dr. Tochi, you were telling, there was a time you were on the program and you were talking about minimum distance of the patient to the practitioner and a patient from another patient, when we're talking about infection prevention and control at a time. Tell us some of these things, that hospitals should know as rudimentary rules.
Mary, we have quite a history, both of us, right? We've had many discussions on this. Your question speaks to what I would like to fit into the built environment of the hospital. Recall that at the start of our conversation, I had mentioned that part of the minimum requirements for health facilities should be the appropriate space that will allow the appropriate distancing between one patient and the other. And that will also allow for proper ventilation. So when these things are in place, you continue to reduce the chances of infection being transmitted. But you see, some of these things cannot happen if you do not have an infection prevention and control program. And why I keep coming back to this infection prevention and control program is that it is one of the main things our national IPC program, the Turn Nigeria Orange, is working hard to establish and to support every hospital in Nigeria to set up an infection prevention and control program. Because it is this infection prevention and control program that will understand the nature of each hospital, the type of care they provide, and then begin to work towards also improving the built environment, improving the IPC practices, providing what needs to be provided.
Thank you so much, Dr. Oko, for coming on the show. I just want to quickly chip in. I know that at the end of this, you will tell us that having vaccines is also one of the things that will help us, relax when it comes to antimicrobial resistance and infection prevention. But we have to come to the end of the show. Thank you so much for coming on the show and sharing your expertise.
Thank you, Mary.
So that's it on the show. Thank you so much for watching. Have a lovely day. I am Mary Alale Yusuf.